Managing PCOS, Steps to Increase Your Pregnancy Chances. Hello, I'm Dr. Stan Yeatts, a board-certified OB-GYN physician. I've had the privilege to help bring over 4,500 babies into this world. Throughout my career, I've had patients who've been diagnosed with polycystic ovarian syndrome, or PCOS. Some of these women encounter fertility challenges. Around 10% of women in the reproductive years are affected by this condition. Often these patients are frustrated. Sometimes they're frustrated with the lack of answers. Maybe their provider isn't taking their symptoms seriously, or they don't know what to do. Sometimes they're frustrated because of the symptoms and the concern that the condition will interfere with their future dreams of becoming a mom. The Greek word poly means multiple. The acronym PCOS refers to the description of polycystic ovary, or ovaries that contain numerous little cysts. However, PCOS isn't just about having cysts on your ovaries. It's a complex hormonal condition that potentially affects your health. The average chance of pregnancy each month is about 20%. PCOS can reduce monthly pregnancy chances from 20% to about 5 to 10%. This reduction in likelihood of pregnancy is due to hormonal imbalances that may interfere with ovulation. My patients who have PCOS and also experience delays in conception express frustration and concern about the future. Diagnosis of PCOS isn't as simple as getting a blood test or an ultrasound. These tests can be helpful, but an experienced women's health specialist should be involved in your evaluation. A medical history is needed to know what symptoms you may or may not have. A physical exam with vital signs and weight is necessary to look at signs of symptoms that are common in PCOS. Then blood tests are helpful to provide clarity, including a complete blood count, metabolic profile, and various hormone levels. The pelvic ultrasound may demonstrate more ovarian follicles than normal, which will add important information to your evaluation. If there is an abnormal bleeding, uterine anatomy is checked with ultrasound for other problems that may be unrelated to PCOS. A syndrome is a condition with a variety of symptoms. Many women have some, but not all, possible symptoms of PCOS, polycystic ovarian syndrome. There may also be a range of symptoms manifestation in women with PCOS. In other words, I've had patients with milder symptoms and some patients with significant symptoms that affected their quality of life. Here are some possible PCOS symptoms. You might be experiencing irregular or no periods, weight gain, acne, unusual male-type hair growth. These symptoms are the result of progesterone and the form and degree of hormonal imbalance. There is a reason for these various symptoms. Ovarian follicles have a small amount of progesterone. When there are excessive numbers of these follicles, there is even more progesterone entering your bloodstream. The progesterone results in possible progesterone effects in your body as suppression of your regular menstrual cycle, weight gain, fluid retention, acne, moodiness, to name just a few. The menstrual irregularities may also cause unpredictable ovulation. Another effect of elevated progesterone is that the various types of androgens, the predominant male hormone, may also increase. The result can be the growth of dark facial hair or on the abdomen, known as hirsutism. Acne is another characteristic sign. Elevated androgens can also interfere with the menstrual cycle and ovulation. Insulin resistance is another possible PCOS symptom. Besides higher blood sugar, insulin resistance makes it harder to lose weight. In fact, it is possible to gain weight when you're doing all of the right things to lose weight, such as exercise and have a proper diet. About 80% of women with PCOS are overweight. The information that I've shared may seem familiar but discouraging. I always want to bring hope. PCOS can improve with some medical assistance and homework. Now let me share some thoughts that have worked for some of my patients. First, let's talk about lifestyle modifications. Women can increase their chances of pregnancy through strategic changes. It's not necessarily drastic, but involves making smart, sustainable choices with a commitment to persevere. The Mediterranean diet is a healthy lifestyle option for everyone. It includes eating 21 to 25 grams of fiber daily, a diet rich in omega-3 sources as from fish, minimal added sugars with elimination of processed foods. Olive oil is a preferred fat instead of seed oils. Studies show that even modest weight loss of 5 to 10% of the body weight, if you're overweight, can improve fertility outcomes in women with PCOS. Another study showed that a Mediterranean-style diet improved ovulation rates in women with PCOS by 25%. Here's some specific supplements that may help. Folate, vitamin B6, B12, C, D, and D. CoQ10, inositol combined with alpha-lactalbumin, magnesium, and potassium. Another crucial aspect of improving PCOS is managing stress. Women with PCOS often experience higher levels of cortisol, which can disrupt normal ovulation. They may feel tired. It's also easy to feel stressed and anxious when you don't see anything changing rapidly. That's why incorporating stress-reducing activities such as prayer, light exercise, yoga, meditation can be so beneficial. Experts recommend 120 minutes of moderate activity each week. This kind of exercise helps the physical body, improves metabolism to prevent unwanted weight gain, but especially helps with stress relief. A study showed exercise and dietary modifications improve fertility outcomes in women with PCOS by 27%. That's why it's a good initial step to focus on lifestyle changes that promote health. Mindset plays a crucial role in managing PCOS. Having the right mindset can help you stay motivated and committed to make the necessary changes to improve your health and your fertility potential. Women with PCOS often experience higher rates of depression and anxiety, which can impact their fertility. Stay consistent and patient. Improvement of PCOS takes time and effort. It's essential to be positive and proactive. It's also helpful to have an encouraging support system, including your local women's health team. Other medical professionals may be beneficial based upon individual needs, such as a reproductive endocrinologist, a registered dietitian, mental health therapist, and your primary care physician. Empower yourself with knowledge about PCOS. Educate yourself on the condition, its symptoms, and effective management strategies. Take ownership of your fertility journey and make informed decisions about your treatment. I want you're not alone in this journey. At Stork Advisor, we're also on your side. And here's your optional action plan. Schedule a consultation with your women's health provider if you have questions about possible PCOS. Try out the Mediterranean diet. Consider incorporating stress-reducing activities that I mentioned before. Start with small exercise routines if you don't have one already. Join our supportive community of women. In my 3 decades of gynecologic practice, I've learned that every PCOS journey is unique. Never get caught up in the negative feelings that your situation is hopeless. Set realistic goals. Celebrate any improvements, even if it's a pound of weight loss or your menstrual cycle is normal this month. You will have the best outcomes if you also have the support of your loved one. Click the link below to subscribe to our channel for more health information and other resources. This is Dr. Stan. I hope some of this information has been helpful to you. I hope that it's also been encouraging to you. Thanks for joining me today.